Hello, we are looking at the scapula. So here we have a left scapula from an anterior view. Starting with originations, we have the subscapularis muscle moving superiorly and laterally. Originating here, we have the inferior belly of the omohyoid. Moving laterally towards the coracoid process. Originating here, we have the short head of the biceps brachii. Lateral to that on the coracoid process, we have the coracobrachialis. If we look here, superior portion of the glenoid cavity originating, we have the biceps, long head of the biceps. On the inferior portion, we have the long head of the triceps originating. Looking at the posterior side, inferior to the spine, we have the infraspinatus muscle originating. Superior to the spine, we have the supraspinatus muscle originating. Originating along the spine, we have the deltoid muscle. Then looking at that lateral border on the inferior portion, we have the teres major muscle. Superior to that, originating, we have the teres minor muscle. And then looking at insertions here on the superior portion of the spine, inserting, we have the trapezius. Looking on that medial border on starting inferiorly, originating here, we have the rhomboid major muscle. Superior to that, originating here, we have the rhomboid minor muscle. Superior to that as well, we have the levator scapulae muscle inserting. And then looking at the anterior side, on the medial border, inserting, we have the serratus anterior muscle, and then looking laterally, inserting, we have the pectoralis minor muscle. Hello, we are looking at the humerus. So here we have a left humerus, looking at it from an anterior view. We are going to start with the origins. So here on that anterior side, kind of on the distal half of the humerus, we have the brachialis muscle originating. If we kind of move distally and look at that lateral side of the humerus, we have 4 different muscles originating here. So starting at the top, the most proximal of the 4 muscles, we have the brachioradialis originating. And then if we move a little more distally, we have the extensor carpi radialis longus muscle originating here. Here, kind of on the lateral aspect of the distal end of the humerus, these are the common extensor origin muscles originating here. And then if we move even on the most distal end from there, here we have the anconeus muscle originating. So staying on that distal end, we're going to look at the 2 muscles originating on the medial side. So here we have the pronator teres originating, and then medially to that originating are the common flexor origin muscles originating here. And if we look at the posterior side of the humerus, we're going to have 2 different muscles originating here. So kind of on the proximal portion of the humerus on the lateral side, we have the lateral head of the triceps originating. And then if we move kind of towards the distal half of the humerus, we have the medial head of the triceps originating here. So now looking at insertions, so we'll start here at the lesser tubercle. Inserting here, we have the subscapularis muscle. And then if we look at that greater tubercle, we have 3 different muscles inserting around this area. So here at the most proximal, I suppose, we have the supraspinatus muscle inserting. And then if we move posteriorly, we have the infraspinatus muscle inserting here. And then on the most posterior portion, we have the teres minor muscle inserting. So then rolling back to the anterior side, we have 3 muscles inserting here, kind of on the proximal end. Moving laterally to medially, we have the pectoralis major muscle inserting. And then moving medially, we have the latissimus dorsi muscle inserting. And then the most medial of those 3, we are going to have the teres major muscle inserting. Then if we look back at that lateral portion of the humerus, kind of in the middle of the shaft, we are going to have the deltoid inserting here. And then if we roll kind of in that same location on the medial side, we have the coracobrachialis inserting here. We are looking at the radius. So here we have a left radius. Looking at it from an anterior view, we are going to start with muscles that originate on the radius. So here on the anterior portion, we have the flexor pollicis longus. Rotating to the medial side, we have the abductor pollicis longus originating here, and then moving distally, we have the extensor pollicis brevis originating here. So rotating back to that anterior side, we're going to look at muscles that insert here. So here at the proximal end, we have the biceps inserting here. And if we move down to the distal end, we have the pronator quadratus inserting here. Now we're going to rotate and look at the lateral side of the radius. So we have three muscles that insert on this side. So looking at the most proximal muscle, we have the supinator muscles inserting here. Moving distally, we have the pronator teres muscle inserting here. And then on the most distal portion, we have the brachioradialis inserting here. Now we're going to look at ligaments and grooves of the radius. So here we rotated to the medial side. We have the attachment for the articular disc. Moving medially to laterally, we have the groove for the extensor digitorum and extensor indices. Moving laterally, we have the groove for the extensor pollicis longus. Moving laterally again, we have the groove for the extensor carpi radialis brevis. Next, laterally to that, we have the groove for the extensor carpi radialis longus. Moving laterally again, we have the groove for the abductor pollicis longus, as well as the extensor pollicis brevis. And then if we move distally, kind of on the distal end of the styloid process, we have the radial collateral ligament. Now we are looking at the ulna. So here we have a left ulna. We can indicate that based off the radial notch here, so we know this is a left ulna. Looking at it from an anterior view, we are going to start with the origins or the muscles that originate on the ulna. So starting from the proximal end of the ulna and then working distally. So we have the flexor digitorum superficialis here on this proximal medial portion of the ulna. Working distally, we have the pronator teres muscle originating here. Moving even more distally, we have the flexor digitorum profundus originating here. And then on that distal anterior portion of the ulna, we have the pronator quadratus originating here. So we're going to rotate and we are going to look at that lateral side of the ulna. So originating here on the proximal end, we have the supinator muscles. And then it's kind of a little bit on the posterior side, but still working distally. We have the abductor pollicis longus originating here. Next, we have the extensor pollicis longus originating here. And then distal to that, still working down, we have the extensor indices muscle. Okay, next we are going to be looking at the insertions. So here on the proximal end of the ulna, on the anterior side, we have the brachialis muscle inserting here. Okay, looking at the posterior side, here on the proximal end, we have the anconeus muscle inserting here. And then if we look at kind of the superior portion of the proximal end, we have the triceps inserting here. Hello, we are looking at the clavicle bone. So this is a left clavicle. We're looking at it from an anterior view. So originating here, we have the pectoralis major. Originating more on the lateral portion, we have the deltoid muscle. On the inferior side, at the bottom of the clavicle, we have the subclavius muscle. And then here, kind of at the medial portion on the anterior side, we have the sternohyoid muscle. And then one insertion here, we have the trapezius muscle.